Good afternoon and welcome to Webinar Wednesday. We're excited to have over 230 registered attendees for today's webinar, which is eligible for 1 credit from the ACI. Okay, let's get started by giving one lucky attendee a Webinar Wednesday t-shirt for answering this trivia question. Today's sponsor, Innovatus Imaging, is headquartered in Pennsylvania. Which city is considered the chocolate capital of the United States? Answer now using the questions feature on your dashboard. While you're answering, I want to invite everyone to save the date for 2 of our 2020 expos. First, for our ICE Imaging Expo, which takes place at the Hilton Scottsdale Resort in Scottsdale, Arizona, from February the 9th to the 11th, which will bring imaging service professionals from across the nation for 3 days of learning, networking, and the latest advances in imaging. Registration is now open, and more details can be found at attendice.com. Also, our Spring MD Expo, which will be taking place at the Hotel Irving, California, from April the 20th to the 22nd. More details can be found at mdexposhow.com. MD Expo is also seeking presenters for Irvine, so you can submit your class idea online at mdexposhow.com, call for presenters Irvine. Details can be found in the handout section of the dashboard, and the deadline is December the 2nd. Okay, let's see who the winner of our Webinar Wednesday t-shirt is, and it is Veronica OJD. I hope I pronounced that correct for Veronica. And congratulations, the correct answer is Hershey. Webinar Wednesday would like to thank our sponsor, Innovatus Imaging. Innovatus Imaging sees beyond boundaries to help healthcare professionals provide better patient care. The company offers the widest breadth of repair capabilities, taking a holistic approach by coupling reverse engineering and rigorous testing to ensure the highest quality of repair and yield rates. For more information, visit innovatusimaging.com. Our presenter today is Dennis Wulf, founder of Innovatus Imaging. Dennis, you may begin whenever you're ready.
All right, thank you very much. Well, thank you everyone for attending today. And what we'll be doing is going through a practical application of ISO 1345. So what I want to do in this presentation, I want to give an overview of ISO 1345. We've had a lot of our customers ask, tell me about 1345. What is it? What does it mean? How do you do things? And I thought, you know, maybe by just showing a practical application of it would be an easy way to do that. So we'll do the overview of the standard, then we'll walk through a practical application. We'll follow a device repair from start to finish. I'm going to reference some of the sections of the standard from a service perspective. What I'm not going to try and do in this is a highly detailed class on ISO 1345. I'm not going to try to discuss every single clause in the standard. So we'll start with ISO, which was derived from the Greek isos, meaning equal. 1345 is the quality system standard for organizations that design, develop, produce, or service medical devices. It's an international standard, but embraces FDA's GMP. The promotion and awareness of regulatory requirements as a management responsibility. Controls in the work environment to ensure product safety and traceability. It adopts a risk management approach from design through product realization. We'll talk a lot about realization. Specific requirements for verification of effectiveness of corrective and preventive actions, and focused on maintaining the continued suitability and effectiveness of the quality management system rather than striving for continuous improvement in ISO 9001. So there's some things in the standard that they clarify, and appropriate is one of the big clarifications. When a requirement is qualified by the phrase as appropriate, it is deemed to be appropriate unless the organization can justify otherwise. So remember that. There are things that won't be appropriate in the service area that would be appropriate in building and designing a new device. A requirement is considered appropriate if it's necessary for product or service to meet requirements, compliance with applicable regulatory requirements, the organization to carry out corrective actions, and for the organization to manage risks. Product. And I think this is a very misunderstood piece of the standard, because the first thing that comes to your mind is a device. But what the standard's saying is when the term product is used, it can also mean service. Product or service applies to outputs. Outputs are results. They're intended for or required by a customer or any intended output resulting from a product or service realization process. That's a very big mouthful of words. So we're going to look at that a little bit as we go through the practical example and as we walk through the standard a little bit. There are some very important terms in the standard. For to be in particular, shall indicates a requirement. You see the word shall a lot. Should indicates a recommendation. May indicates a permission. Can indicates a possibility or capability. So I think something else is very misunderstood about quality systems. Compatibility. It is possible for an organization to adapt its existing management systems in order to establish a quality management system that complies with requirements to this international standard. In a very simple way is you don't have to throw the baby out with the bathwater. Most organizations have a number of policies and practices already in place. You have existing work instructions for things that you do. You have existing documentation. What the quality management system does is it takes all of that and it puts it into an organized system. And what most people find when they're going down the road of ISO 13485 or 9001, I know different organizations are using different ones, you don't have to rewrite everything. You're generally taking what you already do and you're putting it into an organized system. And you're going to adjust it and you're going to tweak it. Your work instructions, as you review them, may need a little more information in them. You'll probably end up putting control numbers on them, doing things like that. But I think a lot of people go into quality systems afraid that we're just going to reinvent everything. You're smart if you don't. And I think that's the most practical way to go into it. So adoption of the standard, why do you do this? So the very first thing it'll tell you is it's a strategic decision of an organization. My strategic decision happened back in the 1990s. I had a small company. We were doing work from some OEMs, and one of them came to me and said, you know, this would be a lot easier to qualify you as a vendor if you had a quality system, a registered quality system. So my strategic decision back in the 1990s was, it was an economic decision. If I do this, I can get more business, I can bring in more customers. And that was the original reason I did it. The next company I had, that was not the reason I did it. What I found by having a quality system, I had a much better company. I actually found we saved money, we were better organized, we put out better products. So my strategic decision was, I want to be a world-class organization. And I encourage anyone that's going down the path of ISO, even if it's being mandated, to take a mindset of, it's because I'm going to be the best. That's a much better reason than I have to do it. So again, it's different for every organization. And if you're building medical devices, it's not a strategic decision. You're required to do all these things. The design and implementation of an organization's quality management system is influenced by the organization's varying needs, particular objectives, product or service provided, size and structure, regulatory requirements applicable to the organization's activities. First time I went through this, we were a company with 12 people. That's one of the reasons I have a lot of background in quality systems. We were so small, I ended up doing a lot of the writing of that quality system way back in time. So you don't have to be gigantic. It's not overwhelming. It is doable. And depending on your size, it may take less time or more time, depending on how much resource you have. And we'll go through that a little bit as well. There's a wide variety of medical devices, and some particular requirements of this international standard only apply to named groups of medical devices. Sterile products is a great example of that. There are all kinds of things written in the standard about sterile products. That's probably not going to be applicable to a lot of things in service. So let's go through some of the sections of the standard at a high level. So the very first section is the scope. Wherever requirements are specified as applying to medical devices, the requirements apply equally to associated services. Something important to remember. There's a number of references. I'm not going to go into those. There are a long list of terms and definitions, which I'm not going to go into. The only four I did was the shalls, the shoulds, the cans, and the may. Quality management system is the fourth section. Documentation requirements. Quality manual. This tells about what we're going to do. So again, we're doing this from a service perspective. So typically in the quality manual, you're going to define the scope of what you do, what you're planning to do, how you're planning to do it, how the quality system is going to work in your company. So I'll give you two examples for a hospital biomed department. You could have in your quality manual that says this applies to every medical device in our system. That's a very broad scope. You could have a narrow scope. This only applies to electric hospital beds. So you really want to define what you want to do. You probably won't make it that narrow, and you may not make it that broad. It really just depends. You can do either one, it'll work. The medical device file, control of documents, and control of records. And we'll go into these things in a little more detail. So section 5 is management responsibility, and section 6 is resource management. From a management perspective, these are critically important for any successful organization to have a quality system. Management commitment, number one. It starts at the top. If there is not a full commitment from management to support this, to give it the resources it needs, it's going to be very difficult. Customer focus, quality policy, quality objectives. Most every company, when they have their audits, they'll ask random employees, what's your quality policy? And it's usually a standard policy about how great you're going to do and all the wonderful things you're going to provide in your quality system. But the next thing most auditors will ask that employee is, now what's that mean? So it's not just reading words and a quality policy, it's really understanding what that quality policy is at all levels of the organization and what it means. Quality management system planning. Management representative. Management representative is the go-to person normally in an organization where if you have a question or you need help, that's the person you're going to go to. Internal communications. Management review, another very large one, including inputs, which are actions, and outputs, which are results. We do these on a regular basis. We have anywhere from weekly to bi-weekly reviews to look at what's going on in our organization, how things are doing. But then we also have an overarching review to where we look at everything in a very big way. We look all across the company, usually a year long of results of what's gone on, how we've done. We'll look at corrective actions, complaints, how our products perform. All of those things happen in management review. And again, this is why it's so important that this starts at the top, because if it doesn't, this doesn't go anywhere. Resource management, provision of resources, human resources, infrastructure, work environment, and contamination control, all addressed in section 6. Section 7, this is where you really get into a lot of the meat of what goes on in a quality system. You've got planning of product or service realization. We're going to talk a little bit about realization. That's basically how you do what you do. Customer related processes. Determination of requirements related to product or service. Review of requirements related to product or service, and communication. Those are all in 7.2, and we'll look at some of those as we go through the examples. I'm not going to go a lot into 7.3. 7.3 is design control, and you'll notice that it says exclusion permitted if justified. Well, if you're designing and building medical devices, this is the meat of it. This is where the hard work and heavy lifting goes in a lot of instances to build and manufacture devices. And the reason this exclusion is in there is a lot of times in a service organization, you'll do none of this or very little of this. So that's one of the reasons I'm not going to go into it very much. Product realization, continued purchasing. and we'll see some of this in the example. Purchasing processes. The organization shall establish criteria for the evaluation of suppliers. The criteria shall be based on the supplier's ability to provide product or service that meets the organization's requirements, based on the performance of the supplier, based on the effect of the purchased product or service on the quality of the medical device, and proportionate to the risk associated with the medical device. That last bullet is very, very important. We don't look at all suppliers the same. And I'll use an ever-ready battery. We're not worried about the risk associated in general with an ever-ready battery. Possibly you could be in some instance, but in general, you're probably not. But then if you're looking at a critical component that can have an effect on patient safety or some of those types of things, absolutely we go through a much more critical evaluation of suppliers. So as you look through this entire standard, risk management is your friend. Figuring out what's important, what's risky, what's not risky can really simplify things. Section 8 is measurement, analysis, and improvement. So 8.2 is monitoring and measurement, feedback, complaint handling. Complaint handling is a big one. You know, what's going wrong, what's happening, and we'll talk more about that. Reporting to regulatory authorities. Internal audit. Internal audit is where you look at yourself. This is probably the best place for any organization to improve their quality system. What an internal audit does is sometimes it'll be an employee that's trained in internal auditing. Sometimes you bring in an outside auditor to do an internal audit, but this is a self-look. When you do that internal audit, they go through all of the standard, they look at how you do things, and they look for things that can be improved. And my answer on an internal audit is you should never have a perfect internal audit or they didn't look hard enough. It's not really there to beat you up. It's really there to help find areas where you can improve. So it's a very powerful tool in the quality system. Monitoring and measurement of processes, monitoring and measurement of product or services. Are you doing what you need to be doing? You have data to back it up. Control of non-conforming product. Actions in response to non-conforming product detected before and after delivery and rework. Rework happens all the time. Went up, did something, failed, had to do it back over again. Are you controlling these things? Are you looking at them? And again, we'll go into some of this a little later on in the example. Analysis of data. There is so much data out there in databases, statistical analysis. You know, what are you doing with all this data? Are you looking at it? Are you using it? Are you using it to make a better organization? What are you doing with your data? Improvement, corrective and preventive action. So now let's go through an example that maybe starts giving kind of a practical application of this. And remember, a quality management system is a comprehensive system. So all of those sections I went through, I'm not going to try and tie every one of those sections to this example, but I'm going to hit some that I think will be helpful and important. So here we have our service call. We have a device that is not working and we need it fixed. Send someone to fix it right away. Never heard that before. So what have we started here? So we've received a service request or a complaint from a department. We're going to assume that there's a management software of some type. So we enter the call in our call management software. We send a technician to the department to look at the problem. And we've now started the creation of a service record. So let's see how that works with a quality system. So we'll start back here in the documentation requirements. So documented procedures and records required by this international standard. So 4.2.5, and you can tell by the fact that I'm skipping down several numbers that we didn't go through all of them. Records shall be maintained to provide evidence of conformity to requirements and of the effective operation of the quality management system. That's all records, not just a service call, that's every record. The organization shall document procedures to define the controls needed for the identification, storage, security, and integrity, retrieval, retention time, and disposition of records. So let's think about that with our service call. How do you identify the record? It has a number on it. It's logged somehow, maybe electronic, maybe in print. Storage, is it cloud? Is it an online server? Is it on your laptop? How do you take care of that? What's the security and integrity of that? Can anyone get to a record? Someone says, hey, let's go into the server and let's pull this record up. Do you just let anybody do that? And by the way, if they did, can they alter it? Then you think of retention time. How long do you keep a record? You know, do you keep it for 5 years after the end of life? Do you keep it forever? And then what do you do with them? What's the disposition of it? When do you destroy the record? When do you get rid of it? How do you do that? So that's all addressed in this section. So we've got this service request now, or a complaint. We need to decide who to send to service the device. So again, let's look at what we have to say here. So that gets back to our human resource requirement. Personnel performing work affecting product quality shall be competent on the basis of appropriate education, training, skills, and experience. That sounds pretty reasonable. The organization shall document the processes for establishing competence, provide needed training, and ensure awareness of personnel. My guess a lot of that happens today in a lot of places, even though they don't have a quality system. The organization shall determine the necessary competence for personnel performing work affecting product quality, provide training or take other actions to achieve or maintain the necessary competence, evaluate the effectiveness of the actions taken, ensure that its personnel are aware of the relevance and importance of their activities and how they contribute to the achievement of the quality objectives, maintain appropriate records of education, training, skills, and experience. Note, the methodology used to check effectiveness is proportionate to the risk associated with the work for which the training or other action is being provided. So I'm going to give you kind of two extreme examples here. We'll go back to our battery. I need to send somebody up to change a battery. Well, how much training does that take? Well, hopefully not a lot. And the other question I ask is, why didn't the operator change their own battery? But now let's have them go in and do something much more complicated to a life support device. You may not want anyone to just walk in, even on a first call basis, to look at that. And what you're having to lay out here is who's going to do what and what qualifications do they have to have. And that has to be in training records. Not only do you have to have a training record that shows that they've been trained on it, you've got to evaluate how effective they are. So a couple examples. You could do cross-training at an organization to where a qualified person is training someone new on it. You might have them do 10 repairs or 10 times whatever that action is to show that they can effectively do it. You may send them off to a training class somewhere. You may want to look at what's the training criteria and what kind of a test do they get at the end to show that they have effectiveness. So again, it depends on how risky it is, and it's really up to the organization to define these things. And if you keep this practical, it's not that difficult. It's really very, very easy. So we have our technician in the department checking out the device. It's clear that the device can't be fixed in the department, needs to go to the shop. So now we'll talk about the work environment and a quality system. The organization shall document the requirements for the work environment needed to achieve conformity to product requirements. The organization shall document requirements for health, cleanliness, and clothing of personnel if contact between such personnel and the product or work environment could affect medical device safety or performance. Ensure that all personnel who are required to work temporarily under special environmental conditions work within the work environment are competent or supervised by a competent person. So maybe a couple examples of this. If you have to work up in an OR, what are the special conditions up there that you need to be prepared for working in that environment versus working in an area down in a shop? It just depends on where you're at. So our technician has a device at his or her workstation. This workstation is ESD Safe, has tools for assembly and disassembly, and has test equipment. So this gets back to our environment. We said it's ESD safe. So back to our product realization, what do we have to do? The organization shall document procedures to ensure that monitoring and measurement can be carried out and are carried out in a manner that is consistent with the monitoring and measurement requirements. This is a very big section. As necessary to ensure valid results, measuring equipment shall be calibrated or verified or both at specific intervals or prior to use against measurement standards traceable to international or national standards, device calibration, meters, scopes, test equipment, all calibrated and in a calibration log. Be adjusted or readjusted as necessary. Such adjustments or readjustments shall be recorded. This is a great example of out of calibration. You went in, you looked at for calibration, it wasn't calibrated. And there are other things I didn't put into this that actually come into play here. Do you have to go look at what you've been working on over some history of time and what this out of calibration could do? Have identification in order to determine its calibration status. Typically, that will be a sticker, a calibration sticker on the device. Some things you can't put a calibration sticker on if it's like a caliper. You may have a control number on that, and you may go back to a calibration log where you sign off that says this has been through calibration. Be safeguarded from adjustments that would invalidate the measurement results. Once it's calibrated, you can't change it. Be protected from damage and deterioration during handling, maintenance, and storage. The organization shall perform calibration or verification in accordance with documented procedures. Records of the results of calibration and verification shall be maintained. Most places have logs and schedules and reminders to send all of their equipment through calibration and keep all of these things maintained. Depending on how large the organization is, this can be a small job or a large job. In most places, it's a fairly large job because you have a lot of things that have calibration. Well, we found the problem. We're down in the shop. Now we can fix this by replacing a defective component. We can source a replacement power supply from the OEM. We can source a replacement power supply from a third party. Now we're into purchasing. So what we want to do in purchasing is we're required to describe or reference the product to be purchased, including as appropriate. And there's that word again, as appropriate. Product specifications, requirements for product acceptance, procedures, processes, and equipment, requirements for qualification of suppliers' personnel. So this can be really simple or really hard, and it's really going to depend. Product specifications. Well, you probably don't have a lot of product specifications. So in a service environment, what is that specification? Well, that specification may be the part number of that OEM power supply. So, that may be it. It may be the component identifier that you're going to replace at the component level. So again, it's going to depend. What's your acceptance criteria? In some instances, you do an incoming inspection. When you receive it in, there may be an inspection procedure that says, hey, before we ever use this, we're going to inspect for all these different things. Then you look at verification of purchased product. The organization shall establish and implement the inspection or other activities necessary for ensuring that purchased product meets specified purchasing requirements. The extent of verification activities shall be based on the supplier's evaluation results and proportionate to the risk associated with the purchased product. Back to my ever-ready battery. Again, we'll take something really simple. When you go to purchase that and you're trying to qualify the supplier, the manufacturers are ever-ready battery. It's not the distributor we bought it from. However, if you're buying from a distributor and every time you get a battery, it's within a month of its expiration date, you may not want to use that supplier. You're still getting an ever-ready battery, but it may not be the quality that you want. And I think this is an area where a lot of people get tripped up in purchasing. The difference between qualifying suppliers versus the item they're getting, because so many things come through distributors. So now we'll assume that the technician has followed the procedure for installing the power supply, has followed the procedure for testing the device, has closed out all the documentation correctly. Oh, now we have a problem. The device that you repaired 2 weeks ago is not working again, and we need it fixed. Now we have a complaint. And part of what I've said on a service request and a complaint, different companies handle things differently, and how regulated you are may or may not be that you call everything a complaint. When you're in the service industry, you expect to get service calls. But when things go wrong, it's clearly a complaint. So we're going to start treating this now as a complaint because we've had an early life failure. This is another big area of the quality system. Gets a lot of attention, drives a lot of activity, unfortunately, but it's not a perfect world. So, complaint handling can be a very important thing. So the organization shall document procedures for timely complaint handling in accordance with applicable regulatory requirements. These procedures shall include, at a minimum, requirements and responsibilities for. And again, these are the minimums in these bullet points. There can be a lot more than this. Receiving and recording information. That can be any kind of information that comes in. It can be a telephone call. It can be an email. It can be a text. There's a lot of different ways that information can come in, and you have to find a way to capture this information and record it. Evaluating information to determine if the feedback constitutes a complaint. Wait a minute, is this really a complaint? How do you know? Is it just an unhappy person or an unhappy situation, or we truly have a problem here? Investigating complaints. The procedure will tell you the steps to go through to investigate complaints. Determining the need to report the information to the appropriate regulatory authorities. Did we hurt or kill someone? Handling of complaint-related products. What are you going to do with this? Well, it's going to depend. Did you hurt somebody? Is there a serious problem here? Or is this minor? Do we need to quarantine this? What do we have to do to this thing? Determining the need to initiate corrections or corrective actions. We're going to talk about that more in a minute. If any complaint is not investigated, justification shall be documented. So let's go to our power supply complaint. We know we put a power supply in here a couple of weeks ago and it didn't work. We go up to the department and the power cord's not plugged in. The power cord's not plugged in. Let's plug it in and see if it works. Oh, look at there, it works just fine. You can close the complaint out. It wasn't really a problem. This would be a very, very simple justification to say, close this out. Any correction or corrective action resulting from the complaint handling process shall be documented. So is this serious? How serious is this? And we'll go into corrective action here in a minute. If an investigation determines activities outside the organization contributed to the complaint, relevant information shall be exchanged between the organization and the external party involved. Very common between suppliers. So if you buy something from a supplier and there's a problem or a complaint, they need to be, and they bought it from one of their suppliers, because there's usually more than one company in any chain because raw materials are put together in finished goods or used in service. It needs to go all the way down the chain to the source and say, look, we had a problem with your product here. Complaint handling records shall be maintained. Should this complaint lead to some kind of corrective action? So we'll go into the standard to help decide that. So on corrective action, the organization shall take action to eliminate the cause of nonconformities in order to prevent reoccurrence. Any necessary corrective action shall be taken without undue delay. Corrective action shall be proportionate to the effects of the nonconformities encountered. So again, this gets back to seriousness. How serious is this? And if it's serious, you're going to be taking corrective action really fast. If it's small things, sometimes it takes longer to get through those corrective actions. The organizational shall document a procedure to define the requirements for reviewing nonconformities, including complaints. Remember management review? I will tell you, this is always a part of management review. We go through and we trend complaints, we trend nonconformities, we look at those things, we analyze the data, and we really get a handle on what's going on. Determining the cause of nonconformities, very important. The worst thing you can ever say when closing out a corrective action is I trained somebody. That's about the weakest cause of a nonconformity. If you're having to constantly go back and retrain somebody, something's not there. Your instructions are not clear enough. You're having materials issues, something, but training, a lot of people try to use that. It's not good. You probably have another weak spot. Evaluating the need for action to ensure that nonconformities do not reoccur. Planning and documenting action needed and implementing such action, including as appropriate, updating documentation. Back to what I just said, you're probably not just going to train your way out of this or go, oh, by the way, you forgot to do this. You better go back and look at your work instructions and how you've developed things to make sure they don't keep happening. Verifying that the corrective action does not adversely affect the ability to meet applicable regulatory requirements or the safety and performance of the medical device. Don't change things. Reviewing the effectiveness of corrective action taken. A lot of times to close out a corrective action is months. Now you may have fixed it in 2 days, but to really verify effectiveness, you've got to look at it at a later point in time. And there's no fast rule about what that later point in time is. If it's something simple, you might look at it a couple weeks later. If you want to take more time, there's nothing wrong with looking at effectiveness over even a year's time. Now you may look at it 12 times, once a month during those 12 months, but you may decide that you can't prove effectiveness until you've seen this work over and over and over again. So again, it gets back to our risk management, the seriousness of it, those types of things. Records of the results of any investigation and actions taken shall be maintained. You always have a record, and the best thing you can think about in a quality management system is if there's not documented evidence, it never happened. Record keeping is very important. Preventive action, easy to confuse with corrective action. The organization shall take action to eliminate the cause of potential nonconformities in order to prevent their occurrence. Preventive action shall be proportionate to the effects of the potential problems. The organization shall document a procedure to describe requirements for determining potential nonconformities and their causes, evaluating the need for action to prevent occurrence of nonconformities, planning and documenting action needed and implementing such action, including, as appropriate, updating documentation, verifying that the action does not adversely affect the ability to meet the applicable regulatory requirements or the safety and performance of the medical device, reviewing the effectiveness, the preventive action taken as appropriate. And of course, you keep records. This is a continuous improvement tool. You can put a lot of things into preventive actions. You may decide that you're going to do a software upgrade to your management system. You may put that down as a corrective action. And what you'll say in that corrective action is, we feel that going to the latest and greatest software will give us better capabilities than we have today. So we're going to do that under the controls of our quality management system. That's a great example of a preventive action. We have in our company that any employee can recommend a preventive action. And they can come in and say, I think there's a better way. We kind of do it this way, and we think there's a better way we could do it. Again, that's a great preventive action. Can we do something to make our company better? Can we do something to make our quality system better? So those are a lot of the very big areas of the quality management system. And again, there's a lot of things in here, but I wanted to keep this towards the service industry and hit some of the bigger points that I think people are not real familiar with. So in summary, The quality management system provides a comprehensive structure to manage, plan, and control how a company achieves high-quality products and service for medical devices. It is not a product or service standard. Product or service standards are an important part of a quality system providing requirements for a device. Don't get them confused. When you see the ISO cert, it's the management system of the company or the organization, not the individual product. A good QMS and the culture of the company drives high quality products. It is not a bureaucracy that no one can effectively follow or something we do before the auditor shows up. I think this is probably one of the top things about quality systems that is so misunderstood. So many organizations go into this with the fear of it. This is going to be a big pain. It's going to change everything we do. The surprise at the end is it got easier, not harder. It's more well organized. It certainly requires documentation and dotting of I's and crossing of T's. But when you take out all the rework and mistakes and the things that happen, you save money, you don't spend money, it's an investment. So a good QMS should always be improving. It should be flexible and appropriate to the organization using it. Very important. Don't make this thing so prescriptive that it's hard to do. First quality system I ever wrote, first internal audit, we wrote Kessler solder and we actually put the part number in, and the guy looked at me and he goes, "Really?" He said, "You realize you're going to have to change this entire procedure with an update if they ever change the part number on that roll of solder or what you do. So you don't want to get over prescriptive. Used correctly, it's an investment that pays for itself." So with that, I can open it up to questions. This gives the contact information for any follow-ups at a later time.
Great, thank you so much, Dennis. We've got a couple of questions. The first one is, if a service provider promotes ISO 9001 certification, is that just as good as 13485?
It can be. And remember, the standards, either one, are tailored to your specific needs. So if you incorporate the medical device areas that are needed for whatever you're doing in 9001, it certainly can be appropriate for medical. I think the advantage to using 1345 over 9001 is, again, if you go back to the as appropriate, you can leave things out that you don't need versus in 9000 trying to add those things back in. So that would be the main difference I would see.
Okay, so if someone claims to have an ISO 13485 certified QMS, can I ask for a copy of the certificate and what should I look for?
The answer is absolutely. It happens all the time. We have people request copies of our certificate and we gladly provide that. Normally on the certificate, it'll have who the registrar is, which company you used. It will also have the scope of what that certificate is for. And that goes back to what I was saying in my early example on the quality manual. Are we doing every device in the hospital in our scope, or are we just doing electric beds? So you want to make sure that the scope of that cert is suitable to what's going on.
Okay, it sounds like ISO 13485 is overwhelming. Is it realistic for an in-house clinical engineering department to do it?
Yes, it is. And I'll go back to my little company of 12 people. It took us a while. You know, we had to do our regular job as well as work on the system. But I think, again, it gets also back to resource planning. I think having a strong quality person that really understands 1345, that can teach it, is very important and help create that standard. But it's not overwhelming. You don't do it all at once. It's not the Big Bang Theory. You do it in a very methodical way and you bring the entire organization up at the same time. That is the best way to do it.
Okay, another question that's come in is, what should we do if a new complaint was caused by a wrong diagnostic?
A new complaint has come, so I'm interpreting that question that something was misdiagnosed, potentially in a service call, saw the wrong thing, or maybe it was intermittent, that type of thing. Is that, am I understanding that correctly?
I presume so.
Anytime. So I'll go in general to it. So whatever the complaint is, you do need to get to a root cause analysis. And I didn't go through all the steps of what you would do. I showed you kind of the overarching, but when you talk about the evaluation and the investigation, that should determine what the appropriate action is. So again, in the evaluation steps, you look at it, was this an operator error? Was it a technician that serviced it not knowing exactly what this example is? But then the investigation should put you on the path of what to do to correct it.
Okay, and another question is, in reference to the topic of documenting OJT, what would be the expectation for documentation for that training event to be put in the employee file?
Good question. So that really depends on what kind of OJT it is, how simple or complex it is. Typically on OJT, there'll be a set of requirements. Let's say you have to install something correctly 3 times. And you'll go through that training, you'll sign off each one of those 3. So after they do the first one in the OJT, you would sign off they did it correctly, same the second time, same the third time. Then you would take that sign off sheet and put it in their training records file.
Okay, I am just waiting on Ted for an okay on a question. Okay. Righty ho. What is the main determination to label an equipment repeated failure a complaint? And what is the time frame involved from initial repair to repeated failure?
Read that for me one more time.
Okay. What is the main determination to label an equipment repeated failure a complaint? And what is the time frame involved from initial repair to repeated failure?
I think it depends. Again, is it a simple device? Is it a critical device? I think it really gets back to the risk management side of it. What's the ramifications of this? How important is it? How critical is it? So I hate to say it depends, but it really does depend. There's no hard and fast answer to that.
Okay, thank you for that. Okay, another one is, how would an in-house group evaluate sourcing replacement electrical components such as diodes, resistors, capacitors, etc., and comply with ISO 13485?
Very good question. So you have to determine that as the quality system, the owner of that quality system. But in general, if you have a supplier, again, this gets back to trusted suppliers, and that diode or that component was made by a manufacturer, and you can certainly buy the equivalent from another manufacturer. I think you would have to look in your quality system, back to risk management. If that, let's use a diode in a power supply, is in a critical life support device or something that could cause patient harm, you're going to assign a lot higher risk factor to buying that diode than you would a very simple device. So that's how I would look at it. If something were that critical, I would probably go strictly with exact replacement. You might want to use that justification. If you can find that you can show you've tested others and they work just fine, that may be sufficient as well.
Okay, I'm just seeing if any more questions have come in. Just waiting on one more question. Okay, right, I think I'm going to, oh yep, we've got time for one more question, Dennis. Just referring back to the OJT question, would that require follow-up training annually for competency review?
Generally not. I can think of some instances where it may, but in general, once someone has been trained and shown competency, follow-up's not required. And I know I'm going to sound like a broken record. Go back to risk. If there was a case where you felt like there should be follow-up, again, this is some very critical device that could cause patient harm, you may want to require an annual recheck. Another instance that could drive that is, I only do this once a year. I got trained on it. I haven't seen one for an entire year, and you may want to get a refresher. So again, it's a little bit dependent on the circumstance, but if it's something you do on a daily basis, I would think you would not have to.
Okay, that is great. That looks like the last of the questions for the moment. Thank you, Dennis, for a great and very informative webinar. And thank you again to today's sponsor, Innovatus Imaging. Just a reminder that the post-webinar survey and certificate process is now automated. So the survey link will be included in the follow-up email, which you'll receive in about an hour's time. Once you've completed the survey, you'll be able to download your certificate immediately. One lucky attendee will win an Amazon gift card for completing the survey. If you have any questions, please contact us at webinar@mdpublishing.com. For more information about our upcoming webinars, please visit our website, webinarwednesday.live. So thank you once again, Dennis, and thank you to everybody who's attended today. Enjoy the rest of your day, and we hope to see you next time.
Thank you.